cannot, we must not, we will not leave our citizens behind. We're going to be focused on jobs, economic vitality, and bringing Philadelphia back from this economic crisis. We're working every day to make this a safer city. Here in Philadelphia.
Hi, good afternoon. Thanks for being here. Seems like it's all health all the time today. Two different press conferences with Dr. Buehler and the great folks from the Health Department. Just one more indication of what great work they're doing. Dr. Buehler, thank you, of course, for being here today. Jane C.W. Vincent, our Regional Administrator, the U.S. Department of Housing and Urban Development. Halleck Ravel Nelson, Director, Philadelphia Environmental Health Services, and the entire Philadelphia Department of Public Health and the Health Department Environmental Division staff. Good afternoon, and thank you all for being here. This is a quite exciting announcement here in Philadelphia. Philadelphia, our city government, we've worked hard to ensure that our city is a safer and healthier place to live, work, and raise our families, have some fun. Through the innovative and important work of our great and nationally recognized Department of Public Health, we've seen decreases in obesity and smoking rates and increases in the public's access to healthy and affordable food as well as health services. And earlier today, we announced a new initiative in a partnership with the Department of Recreation, Parks and Recreation, with the Health Department, Philly Powered, and helping folks get more information and more opportunities for those healthier lifestyles. For more than 40 years, we've been working to prevent lead poisoning in children across our city. In older urban areas, hazards in the home can present a serious risk to the health and safety of our children and families. Philadelphia in particular faces challenges around lead poisoning because of our many older homes that have been painted with lead-based paint. Now, over time, that paint has been covered over, sometimes many, many times, with safer alternatives, but the dangers still exist. Paint peels or chips can be ingested or inhaled, increasing the chance of triggering a child's asthma attack or being poisoned. Our efforts have been long but successful. We've reduced the number of children with blood lead levels elevated over the years. Our Lead in Healthy Homes program, formerly known as the Childhood Lead Poisoning Prevention Program, that work has been twofold: educating the public, social service agencies, and child care providers about the risks of lead poisoning and the importance of lead screening, and alleviating the conditions that cause childhood lead poisoning in the first place. Over the years, that mission has been expanded to address the full range of healthy home hazards for low-income families. Like our partnership with St. Christopher's Hospital for Children called Healthy Homes, Healthy Kids, which serves children with difficult-to-control asthma by improving indoor air quality and the environment. Through this collaboration, we've helped to reduce child emergency room visits and doctor office visits, as well as missed school days. It also assists families by providing a lead-safe environment for many of our low-income children who live in aging homes across the city. Our lead poisoning prevention and healthy homes work uses innovative strategies and a neighborhood-based approach to reduce the risk of lead exposure citywide. But our efforts would be considerably less successful without the significant support of the United States Department of Housing and Urban Development. For more than 20 years, we've partnered with HUD on initiatives that combat lead hazards in homes. HUD has helped us develop dedicated teams, community partnerships, outreach efforts, as well as home remediation efforts as well. And today's announcement will only strengthen our efforts and our relationship with HUD. I want to thank the U.S. Department of Housing and Urban Development for its continued support and for bringing some very welcome new resources to the Department of Public Health and the City of Philadelphia. It's my pleasure now to introduce our Regional Administrator for HUD right here in Philadelphia, Jane C.W. Vincent. Jane?
Thank you, Mayor Nutter, and it is really a pleasure to, as always, be here with the mayor who has shown such great leadership in this city on behalf of the residents. I do feel like, knowing what your earlier event was today, that I should do a few jumping jacks, but we are going to be working on a different part of our Healthy Homes initiatives. I'd like to really think that this is a great way to highlight National Lead Poisoning Prevention Awareness Week, and thank our two guests here, Dr. Buehler and Dr. Ravel Nelson, for the passion and commitment that they have to this work, and really highlighting the priority that the city of Philadelphia has placed on this issue. There have been many other partners that have brought this initiative to life, and after all, it is lives that we are talking about. So I'd like to recognize not only St. Christopher's Hospital for Children, but Temple Hospital, the Mayor's Office of Housing and Community Development, the Philadelphia Housing Authority, Philadelphia Gas Works, Habitat for Humanity, Public Citizens for Children and Youth, and Green and Healthy Homes Initiative, and there are more. Certainly, it takes all of us working together. So it's my pleasure to be here on behalf of Secretary Castro and HUD's Office of Lead Hazard Control and Healthy Homes, and of course, the entire Philadelphia Regional Office. We all know that housing and a home is more than just bricks and mortar. It's where we build our lives. For too many of us across the country, home is also a place that can be a hazard and threaten our lives. Data shows that there are more than 30 million houses here in the U.S. that have significant physical problems. Lead, radon, things that cause asthma, respiratory illnesses, lead poisoning, and even cancer. What is even worse is that there are families who just cannot afford to move into better conditions. Here in Philadelphia, for example, studies show that the 2 zip codes with the highest number of children living in poverty have asthma rates of 47% and 40%. Children should not have to be in harm's way when they're watching cartoons or when they're joining their family for dinner. Poverty should not sentence a family and an individual to a lifetime of health issues and health problems. Everyone deserves a chance to live in healthy communities. So to the task at hand, what we really hope is that our announcement today can go a little bit further in helping our families. I am proud to announce that HUD is awarding $3.7 million to protect Philadelphia's children from lead-based paint and other health and safety hazards in their homes. The investment will provide funding for outreach and education, for comprehensive assessments, for lead hazard control interventions and remediation. The remediation is expected to help something like 285 homes and maybe 750 families receive counseling. It seems like a small investment for the number of people that will be reached. This is part of a national campaign where 32 local and state agencies will receive almost $101 million to contain childhood lead poisoning and household hazards. So we all know that a healthy home is important and leads to healthy lives, but it is so much more than that, and our happiness and future success often depend on a healthy home. I really want to congratulate the City of Philadelphia for the great work you already have done and will do with this grant.
Thank you, Jim.
Thank you. My name is Dr. Jim Buehler. I'm the Health Commissioner for the City of Philadelphia. We've made substantial progress in reducing the percentage of children with elevated blood lead levels in our city. Yet, despite that progress, we still have over 500, or about 500 children a year who have an elevated blood lead level based on the standard of 10 micrograms per deciliter of blood. If we look at the newer standard that reduces the criteria for being concerned to 5, we have even more children who are at risk of exposure and disease and the problems that are associated with lead. In our city, as in other cities with lots of old homes, the the most common source of lead is, as you've heard, deteriorated paint and dust in older homes. Both as a pediatrician and as a parent, my kids are now grown up, but for those of us that have kids, you know there's a certain age of development where they explore the world by crawling around on the floor, and a lot of that exploration involves putting things in their mouths. And if there's lead dust in the home, that's often how young children get exposed. Lead paint can remain under layers of newer lead-free paint, but yet the chipping and peeling that occur creates a lead dust, and that's often invisible, and yet the small kids are getting exposed to it. There's no safe level of lead. We know that even low levels of lead can result in reductions in IQ, behavioral problems, learning disabilities, and several other health problems. Simply put, we know that there's a relationship between lead exposure and the ability of children to do well. The home should be a place where people are safe and can be healthy, especially children. Too many of our older homes have lead paint that can be a hazard to children, and too many of our homes have other conditions of disrepair that create health hazards for children, particularly triggers for asthma. This new grant is a wonderful opportunity to help us expand our services that include counseling, guidance to families, but also, when needed, actual interventions to remove those hazards in the home. This is going to allow us to help hundreds of families protect themselves and, when needed, make the repairs that will reduce the risk of lead exposure as well as other indoor health hazards. So we're just thrilled to have this new opportunity. Thank you so much. And now I'd like to introduce Dr. Palak Ravel-Nelson, who directs our Division of Environmental Health Services, which is responsible for our lead program and our Healthy Homes projects.
Good afternoon. As Dr. Buehler mentioned, I am the Division Director of Environmental Health Services for the Philadelphia Department of Public Health. One of the program areas under the Division of Environmental Health Services is our Lead and Healthy Homes program. And I feel truly honored and privileged to be able to not only run the division, but to have HUD here, who is awarding us with this grant that is going to truly make a big difference in the lives of children in the city of Philadelphia. I just wanted to take, while you've heard the hazards about lead poisoning and the mayor's comments and HUD's comments, I just wanted to take a couple minutes and just share two stories with you about two families that we've helped through prior HUD dollars and the impact that has had. So just bear with me. The first story is about Raina. At the age of 15 months, Raina was diagnosed, or there was an elevation in her blood that was found through the state's NEDS database reporting system. The moment that the Lead and Healthy Homes team, and they're sitting over here, discovered that, we have a case management system, and the moment that the team discovered that about Raina and her family, we went into action. We went ahead and we conducted an educational presentation for the family. Our certified risk assessors conducted an inspection and outreach to determine the sources that were poisoning Raina and what was causing her lead level to go up. We determined the environmental action plan that was needed. We educated the parents and the caregivers. We also did inspections to determine whether or not there were any outside sources that were poisoning Raina. Once all of that was determined, we found out that the family did qualify for the HUD funding. We had them go through a grant application process, and as soon as that was done, we helped the family relocate. Our team of contractors went in, remediated the home, and reduced the lead hazards and made the home lead safe. Raina's, soon after, when we did follow-up, our nurse discovered that Raina's blood lead level had dropped, and she is doing well. So that is one example of a family that we've helped that was lead poisoned. And on average, there are 500 kids a year that are impacted by this. So our hope is really to stretch those HUD dollars. The other example is, as Dr. Buehler mentioned and the mayor mentioned, we expanded our mission in 2011 to include healthy homes hazards as well. All of those things that are in a home environment that cause children to get ill. We specifically, our Healthy Homes program focuses on asthma and asthma triggers. So the next story is about Stephanie and her 4 children. We found out about Stephanie, and we got to meet the family, and we learned about Stephanie because her youngest son, Joseph, constantly spent time at St. Christopher's Hospital with severe asthma attacks to the point where he could have died. He's a little boy, about 4 years old, and all he wanted to do was to go outside and play with his cousins and his brothers and his friends, and he couldn't because of his asthma and the asthma triggers within the home. St. Christopher's Hospital, who's one of our partners, went ahead and referred Stephanie's family and Joseph's case to us. And we went, and once again, our Lead and Healthy Homes team got energized. We went out, we conducted education. We did a full risk assessment with all the Healthy Homes 29 checkpoints. We identified the sources of the asthma triggers, and we developed an environmental action plan for the family so that they knew what they had to do, what their role was, because our goal is really to empower the families to take the actions to help take care of their children. And our assessment revealed that the home had roof leaks, had mold and moisture issues, had old carpeting, had a pest control problem. And one of the things that we learned is we're fairly lean and mean. So we had our own vector control program area of environmental health services go in and do integrated pest control within the home to minimize and mitigate the pest hazards. And with HUD funding, we went ahead and hired contractors, and we remediated the home and conducted a follow-up assessment and removed the carpeting. And, you know, if it was a PowerPoint available, I'd show you the after pictures, the before and after pictures. Long story short, Joseph is doing fine, has not been in the hospital since we did our follow-up. So those are just 2 examples of the work that the Lead and Healthy Homes team does and how we help kids. So in summary, as the Director of Environmental Health Services for the city, I believe it's not only my job professionally to help our most vulnerable citizens, the children of Philadelphia, but it's also my life's work and my passion to make sure that those that can't speak for themselves are helped and that we are their voice. So with this funding, Lead and Healthy Homes will carry out the mission of environmental health services and help the citizens that are most in need in Philadelphia. And on behalf of Lead and Healthy Homes and Environmental Health Services, I thank you, HUD, the Commissioner, and the Mayor for all of your support. Thank you.
So I think with that, hi. I think we have a little bit of a
We
presentation.
do have
Yeah.
a presentation.
Thank you.
We do have the big check today.
Yeah. Love a big check.
We've already been discussing if it could be photographed and deposited electronically. So to the Philadelphia Department of Public Health, $3.7 million. Thank you very much.
Great. Thank you very much.
I don't know if you're aware of it, but we all get a lot more done with your money than others. So I know that's because of the great work.
We like to hear that. I think congratulations, everyone, and again, Regional Administrator Jane Benson, thank you so much, and all the team at the Philadelphia office, and certainly our best back to Secretary Castro. Great job, the 2 doctors over here, and the Philadelphia Health Department. Any questions on this announcement? Okay. Fantastic. Let's go take care of some kids. Take care. Bye-bye.